honest. A lot of these things are common sense and really best left up to the individual. You know, we are not going to create any mask police. You know, I know there's communities that have enacted ordinances to require masks in retail settings. You know, again, there are no mask police in our county. I could probably ask Brad if he feels that way as well.
I agree.
You know, this is all up to the individual. I talked about it Monday night at the council meeting. This is probably going to be the theme for me, is that, you know, to get to where we want to be, we've got to continue on. We can't let up. And you know, when you go into a store, wear the mask. You know, it just makes sense. Again, I don't think the state and local plans are going to will advance unless we improve on the 4 measurable metrics that the governor set out. So talk just a second about that. I did want to mention with regards to masks that Fire Station on Center Street continues to collect masks from volunteers, and we would appreciate that continuance because, again, I think masks for the public when they're at retail and at work are going to be critical, especially these next few phases of this plan. So we will continue to accept those masks and distribute them. Again, they're washable, can be reused. We'd ask that you please just take what you'll need, but more importantly, take what you're going to use. I know we've got a little bit of a problem with people coming in and grabbing big handfuls of masks, and I don't think that's fair to those that are now without, because we've run out of them. I think we are currently out, but again, our volunteers and volunteer organizations have been very good about trying to keep us supplied. So again, I tell you how important it is to have a mask, and ask that you utilize our volunteer distribution point at the Center Street Fire Station to do that. Excuse me. Again, back to what the city's going to do to be opening and talking a little bit more about what we opened up with. You know, the governor's plan and the local plans will be, we're going to talk about here this morning, primarily the local plan. We're still kind of in our final stages. I've had 2 meetings this week with the department heads, or actually since last Friday, and we continue to take information from them. I think we've got a pretty good draft started, and we'll talk about some of the details this morning. But remember that, you know, this plan is only as good as our progress, and we're in stage 2 right now, and we're not going to look too much further beyond that, maybe into stage 3 a little bit. But the important thing is we've got to continue our diligence in stage 2. That being said, you know, the city has been open for business by phone, text, email, city website. We continue to provide the services necessary. The only difference is that all of our public buildings are closed, and they will remain closed until June 1st. And at that point, we'll reopen the buildings, but with restrictions. And again, I'll go into that in a minute. How we move ahead is, again, going to be based on the 4 metrics that the state has set up, and also looking at our local, countywide, and even regional statistics. If we need to dial things back a bit with the expertise of our county health department and looking at these metrics, we will not hesitate to dial back if we feel we need to. But we do need to have these plans set out so we have something to work from. As far as I'm concerned, the further out that these matrices and stages go, the more tentative they become, because again, we don't know what's going to happen in June. We don't know what's going to happen in July. We can only hope what we want to happen then, and that's what these matrices tell us. So again, this morning I'm going to be primarily focused on phase 2 and 3. Many of these will be with restrictions. Our Parks Department will probably come out with a matrix of their own of activities and restrictions later this week. I will touch on a few of those this morning, but again, all of this, every bit of this is subject to change as conditions dictate, and also is by no means to be considered complete. There are continual questions that are brought up, and it's, oh yeah, we didn't think of that. So we're still evolving in this process. So just to give you an idea of how we're handling this, again, our employees this week are preparing to return. We're preparing our workspaces here to get our employees back in a safe environment. They will all transition back to City Hall and all of our public buildings and departments next week. By the third week, which is May 18th through the 22nd, our employees will be fully scheduled. Our stay-home pay order ends on the 15th, and again, we don't anticipate that moving forward. We will continue back with our normal schedule and payroll. Excuse me. As far as the buildings, we continue to keep our public buildings closed. We will meet and have meetings by appointment only, but the buildings will remain locked. We will continue to practice those safe distances, social distancing, and hygiene practices, even with private meetings going on. Again, we look at potentially on June 1st opening the public buildings, city buildings, with restrictions, and we'll see how that looks as we move forward. That's midway through stage 3. Our public meetings will continue to be virtual, or we'll have the capability to do virtual meetings. The Public Access Counselor has allowed that those continue through June 4th. I'd like to continue those beyond June 4th. We'll wait and see what happens. And tentatively, if the governor's emergency declaration and his executive order that allows virtual meetings runs out on June 4th, then we're back to our regular meeting. So more to come on that. We're not sure how that looks. Again, that's still midway through stage 3, and we don't know what's going to happen beyond that. Obviously, in-house, we'll continue with our social distancing. In all of our public buildings, we'll create markings, floor markings, and signage once we open up to assist with that. We will be requiring the public to wear masks on June 1st, at least through the end of stage 3, which would be the 12th, that they wear masks into our building, and that, again, could continue into stage 4. We'll see how that goes. Just for reference, public and private social gatherings are now limited to 25 through stage 2, which is May 22nd. Following that, they'll move up to 100 for phase 3, which is through June 12th, and beyond that, less than 250 from June 15th through July 4th, and then beyond. Again, I don't want to look beyond, quite frankly. With regards to some parks initiatives, we're looking at reopening our playgrounds as directed by the governor in stage 3, which would be May 25th, which would include tennis and pickleball. We're going to keep the basketball courts closed because we don't feel like we've got an opportunity to control social distancing. Tentatively, we may open those up in stage 4, but again, let's stay with stage 2 and 3 now, that when stage 3 occurs, we will be opening or attempting to open our playgrounds, tennis and pickleball, depending on our conditions. Our campgrounds will also be allowed by the state to open up for our seasonal rentals only, and that would be May 25th. And then potentially our outdoor picnic shelters will not open up till June 15th as far as the rentals of those go, and those will be limited to 50% capacity. As far as our other rentals, the pavilion, fire building, Nye Youth Cabin, Lucerne, the amphitheater, they will all remain closed until we get to stage 5. And again, that's a long way away, so something may happen then, and most certainly we'll involve less capacity. We potentially will resume our Friday night concert series July 4th with social distancing, but again, we're getting a little beyond that. We're looking at tentatively, tentatively opening the BMX track in stage 4 and potentially some practice earlier by appointment with a small group. This year we've decided to put a moratorium on leasing out our picnic tables and sawhorse tables, given the concerns with sanitization and so forth. Our beaches, again, we're definitely remain closed until, at this point, we're looking at potentially on June 15th. We're not sure exactly how that's going to look, but that's the date that we're kind of looking towards. Mantis Skate Park will not open until July 4th, again with restrictions. So again, a lot of what I've mentioned is tentative with more details to follow. The parks will come out with a matrix that talks about these different recreational activities and spaces. Just like everything else, we're trying to look at how we could reopen. The dates right now are tentative, period. And the details have not, the restrictions have not been finalized. So look for things potentially to open slowly, but potentially not be the same as they have been in the past. So I think that's all I've got to say this morning. I'd like to turn it over to Brad Jackson from the county. And again, thank the county for everything they've done, cooperation with our law enforcement, with public health. We could not do it without what you all have done. So thank you, Brad. And
it's been a good team effort.
Yeah, I appreciate all of that.
Yeah, kind of springboarding off that. I'm just always have been, but continually amazed at our community. I mean, we have restaurants that are, severely restricted right now as far as, their ability to make money, yet they're giving out meals and stuff. And then the masks, like the mayor was talking about, I mean, and I know this happened all over the country, but it just makes me proud to be a part of this community. As far as the county, we've tried to implement plans and have plans ahead of time so that we're not taken by surprise. So far, it's pretty much worked. An example of that is weeks ago we contracted with an outside professional cleaning facility that if we have anybody that would test positive, would have them come in and professionally clean that area just to be extra safe rather than having our own staff do that. As far as our reopening plan, ours is a little bit different, but somewhat similar. Next week, starting May 11th, we will have all of our team back in, but we will still be by appointment only to the public at that point. And then on May 18th, we plan to go ahead and reopen. We're going to allow each department head, because our officers are so different in their configurations, to decide if they want to have a table outside their office to keep people from coming in, if they want to have the plexiglass screens you're seeing a lot of put up. So that'll be up to their discretion again, because they're all so different. But the one thing I'd really like to stress and get out to the public as we're asking is, please, when you have to go to the courthouse to conduct business, whatever that might be, please come alone. Don't make it a family outing and bring a bunch of people along. We may, if this is a problem, start to restrict that to just one person, but we hope people just respect that. And if you need a birth certificate, a permit or whatever, just come by yourself and conduct your business. So that's really all I have. You covered most of the other stuff.
All right. So yeah, I think we're pretty similar in our employees coming back. You guys are maybe opening up a little sooner, but I know you all have a lot of interaction with regards to paying of taxes and property tax forms and all the services you provide. So I'm certainly fully supportive of what works for you all. And again, it's kind of the story with businesses as well. just because they're allowed to open at a certain date doesn't mean they're going to open. They have to feel comfortable with their employees, with their work conditions, with their dealing with the public, and everybody's got to make those decisions with guidance from the health department and the state. But at the end of the day, again, it's up to the business, and it's up to all of our patrons to continue to try and honor the need to keep this spread down. So, all right, Dr. Remington, I think you're on. I certainly appreciate all you all have done keeping us informed. These statistics continue to be critical as we move forward, and I know the governor's office has talked about I think that surveillance study, the Fairbanks study, and the contact tracing. They're trying to centralize that. I know that's something you all have been doing, trying to get a database, and those are two things that are incumbent or are required for us to move forward. So if you could comment on those things, as well as you probably have a lot to say this morning yourself.
Well, thanks, Mayor. We are very fortunate, continue to be very fortunate in Kosciuszko County in the pressure we have felt from this novel coronavirus. We have heard of terrible stories in larger metropolitan areas, and we are fortunate. I do have some latest numbers for you. Our total case count since this started is up to 39. We know of 20 of those who have recovered, and we've had one unfortunate death. In the past week, we have had 5 new total cases that have been reported to the health department. 3 of those are symptomatic, leading to their testing. 2 of them were not symptomatic. Testing was done outside of traditional means, perhaps part of a mass testing at an employer. As of this conversation, as far as we know at the Kosciuszko County Health Department, we are unaware of one of our residents being hospitalized or being in an ICU with a COVID-related complication. So we continue to feel mostly relatively minor to moderately ill cases in our county. The case count has gone up a bit, largely reflecting increased testing, we think, and particularly increased testing via employers for asymptomatic employees. So again, thank you for the citizens of this county for being willing to voluntarily pursue the mitigation steps that have been difficult. Closing businesses, not being able to attend mass gatherings, do favorite things. We think it has led to the place we're at today, so thank you very much. We are fully supportive of the state's plan for an incremental opening up. Now, there are all types of permutations on a theme that you'll hear in different communities of what that looks like. But I think take a step back, and the important point being that it is an incremental opening up. So you take a few days forward, 10, 14 days, take a look at what the metrics are showing from the public health sector, and if it looks good, you move forward again. We will see more cases. Testing is becoming very available, so you will have more cases. Perhaps the single most important metric to follow, and I hear this at the state level in their conversation, is new hospitalizations. So we hope to keep a finger on that pulse, particularly even locally, but the state's going to have a big role. In their plan that was unveiled by the governor Friday, the State Department of Health has a prominent role in three categories, 3 priorities. They're increasing testing capacity and primarily testing every person who feels they are symptomatic, getting them to a test, and the close contacts of those positive cases, even if those close contacts do not have symptoms, but they need to get to work in a critical infrastructure job try to get a test to them to help make decisions regarding the advisability of quarantine or return to work for them. That's a tricky topic. So again, priority number one from the State Department of Health is increasing their testing capacity. Priority number two is to scale up investigations, contact tracing, isolation, and quarantine. That's largely been, up until this point, a checkerboard across the state, jurisdiction by jurisdiction, using local health departments. I am proud of the work of our local health department. I feel we've really rolled up our sleeves. We've put a nickel in this, and I felt we've been spot on. Not every health department is robustly staffed. No health department is hugely robustly staffed, I might say, but some are even much leaner than ours, so this has been difficult. So as testing goes up, the need to centralize that case contact work is important, and the state has contracted with a vendor to move us forward with that. In this county, that should come to us in about 2 weeks, barring any complication. So we'll continue to do our traditional case contact work for the next 2 weeks, and then we'll learn the new life with the centralized process from the state. They are working on very open means of communication so that we're kept in the loop as a health department, and thus we should be able to quickly get critical information to our elected officials who need to make good decisions regarding their opening up plan. So that will be something new for all of us, and I think it'll be a good thing. It'll free us up at our health department to do other work that we have to do and allow the state to make sure there's a consistent messaging across the state. And their third priority at the state then is data collection and analysis to make sure they see in real time outbreaks. So data, again, that should flow from this centralized case contact work, should quickly enter the database for the State Department of Health. I know the Regenstrief Institute is working with the State Department of Health and the Fairbanks School of Public Health critically in developing the appropriate real-time metrics that'll be flowing. This is very sophisticated and it is very data-driven. If you hear some nod that we are not pursuing a data-driven pursuit of opening up in the state of Indiana, it's frankly nonsense. This is extremely sophisticated. Not that there won't be lessons to learn and some perhaps painful lessons along the way, but it is being done very intelligently. So I think we're on the right track, and I would ask that the citizens of Kosciuszko County continue to keep their foot on the gas with the best thinking regarding our social mitigation steps. Please wear a mask when you're in a retail establishment and you're walking into a crowd and you know you're going to be walking into a crowd. Have a mask on. We don't intend to force anybody to throw a mask on, but we think it's good policy until we don't have to do this anymore by our best estimation. So thank you.
Dr. Remington, I know, I believe it was last week or potentially the week before, we're all kind of blending together, but the state announced an increase in testing that I think you alluded to here this morning. Mm-hmm. They're looking at adding 50 different sites. Yeah. I think they've got 20 listed now, and they're going to ramp up within the next few weeks. The goal is to hit 100,000 tests a month more than they are now. I know that Kosciuszko County is not on that list. That might be a good thing, but you had mentioned that the availability of testing is improving to the point where those that feel like they have symptoms now will be able to access a test. Tell me how this state ramp up in testing will indirectly, I suppose, help us locally as we need to provide more tests to those individuals or employers that are potentially concerned about an outbreak.
So currently, patients who are symptomatic should seek care either through their primary care physician or an urgent care center. If you're very ill, of course, go to an emergency room. You should have availability of testing through those venues of traditional health care. Private labs are largely used for that, as well as, on occasion, the State Department of Health lab, and there's robust capacity for that. That may not fit every situation, though, so the state is ramping up testing with 50 sites eventually across the state. Kosciuszko County, our community, should, we think, have a test site in the second wave, which will not be this next week, but perhaps, I think that's 2 weeks away. And I believe they're using the Armory setting for that.
Okay.
And that's at no charge. It still is mostly symptomatic people or a close contact of a known case, and a test would be needed to help make a decision regarding return to work or how long to extend the quarantine. So that'll be one way to expand testing. The state's doing that. There will be, I think, billing of an insurance company if it's available, but if you have no insurance, you feel you fit the criteria, then you can show up at that setting at the dates allowed. There will be information on the state's testing site map regarding that, and I believe the triaging questions are a quick click away, so you can decide if you fit their criteria. So the private sector, the public sector, that's second opportunity. The State Department of Health sends in strike teams. So here's a third venue of testing. Those strike teams can be sent into congregate settings that are felt to have a growing number of clinical cases, and they want to be doing aggressive case contact work and case identification. So traditionally, those have been nursing home sites around the state, and relatively recently, more attention in the industrial sector, particularly meat and poultry processing.
Do those tests, are they, that strike team, if you will, is that requested through the Department of Health, or do these congregate settings make those requests directly? I
believe that's it can occur either way. It's fortified if you work through the local health department, I believe. So there's 3 venues. There is a 4th venue if the state sees a popping up of cases in a particular geographic vicinity. They will develop a drive-through testing site quickly for that geographic area. So there are 4 venues of developing increased testing as we see it now. And this will continue to expand and become more palpable to people moving forward. So testing capacity is more robust now. And again, when we say testing, this is mostly still the nasopharyngeal swab, looking for the RNA evidence of this novel coronavirus. And it's best done with symptomatic patients or close contacts. Whole-scale testing of people who have no symptoms would be best left to a surveillance program, like what the Fairbanks School of Public Health is doing with the State Department of Health, a randomized study. And I think through this weekend, they were hoping to recruit up to 5,000 randomized people across the state to do this testing. I don't know those results yet. Those are not available. The use of antibody testing, that is a blood test to see if you've had it, is still not perfectly vetted in the public health sense anyways. I've listened to several webinars just in the last week, and I have yet to hear anybody propose whole-scale use of blood antibody testing as a case management technique. Again, surveillance testing and a randomized study like what Fairbanks is doing, yes, but not in a case-by-case basis. So testing will be more robust. It already is plentiful and available, but perhaps not so easily palpable for every individual in the county. So that will improve.
All right, thank you. All right, so this morning we have Jeff Rocket from Parkview. Jeff's our local Director of Outpatient Operations at Parkview here in Warsaw, and I've asked him to come and talk a bit about how Parkview has gotten through up to this point and how things look moving ahead, both here at our local hospital and system-wide. So, Jeff?
Thanks, Mayor. Thanks for having me today. It's been an interesting time in healthcare, one that we didn't really anticipate going into, and it's had its challenges, but I think in the end, I think we're going to come out of it ahead. You know, I think it's forced us to really look at our processes and how we take care of patients and how we deliver healthcare today and going forward. And so I think there's a lot of good that's going to come out of this challenging time. So it was interesting, we activated our incident command about 8 weeks ago, really going into this novel coronavirus crisis with a bunch of unknowns. We knew very little about the virus and impact. And what it gave us the ability to do was really take a look at our infrastructure and take a look at our processes and things that we had started to implement, but maybe not to the full effect, right? So, we quickly began looking at how many negative air polluters that we have, knowing that this was a very painful airborne device. Certain procedures made it even more so, right? That it was such a respiratory virus. So we looked at how can we increase our negative air polluters. So that was one of the first things we did. Making sure that we had ventilators and then
Would you turn your microphone?
No, sorry.
All right.
There you go.
Thank you.
So sorry.
Sorry about that.
That's right, sorry. Making sure that we had adequate ventilators in the event that we had a number of inpatients that required them, and really monitoring that. Really setting up our system, looking at our primary facilities in Allen County, our local community facilities, and really strategizing how we would take care of our communities and our patients going forward, right? So it's been a very exciting time as we look at that, and it gave us the opportunity to really take our platforms of telehealth that we had been working on and we'd used somewhat in the past, but we had the opportunity to really put those into place and following the quick need to shut down services or limit services to true emergent situations. How could we best protect our patients? So keeping safety for our patients, our communities, our employees, our healthcare workers has always been first of mind. And so everything that we've done with safety first and foremost and the mindset. I thank you and I appreciate what you said, Mayor, about supporting Governor Holcomb's staged plan of reopening up the state and really focusing on stage 2 and going into stage 3, right? We don't know how long this is going to take. We don't know how long the tiers of reopening are going to be as we go through this. The worst thing we can do is open up too quickly. And, so I think really focusing on this initial stage 2 with the groups of 25, opening up more services in the facilities, opening up businesses, I think is really the best strategy, and not setting hard dates on when we transition to the next stage. As we have refocused our incident command from the planning and preparing of what COVID-19 might bring to us in the healthcare hospital setting, we now changed our focus on to how do we equip not only our facilities and our providers, but our communities for this reopening? How do we stage it in such a way that we begin to provide services so that people that have been isolated and not receiving health care can come back in and get it before their health diminishes or we have further problems with healthcare in the communities. And so, we've begun opening up surgical services and we've increased our outpatient services, really with every step keeping safety first and foremost. We've talked about the community support has been phenomenal, and we could not have done this without the support of the community. The Make a Mask program has helped us so much, as everyone's heard the challenges with PPE and the news and the headlines, and really making sure that our healthcare workers had the appropriate PPE to take care of these patients, and that we had protective equipment, masks for our patients and our visitors coming into the healthcare setting. You know, one of the hardest decisions we had to make was really restricting visitation. We had to go to a 0 visitor restriction, and that was very, very difficult for our communities and our patients and families to deal with. But we did it because it was the safest thing to do. You know, as we've begun opening things up, we really are modeling the masks as well as, it's more than a mask, right? Engineered controls. How do we develop and place engineered controls into the hospitals and the healthcare environments, the workplaces that help distance, right? We heard Governor Holcomb talk in all of his stages about the importance of social or personal distancing in the continued fight with COVID-19. And so masks first and foremost, but we've got to have other engineered controls in place to help mitigate people congregating together. You know, as we start opening up more, it's human nature to want to congregate with your peers and with your friends. And how do we begin to open things up, add services to the hospitals and healthcare setting, and still maintaining that distance, right? So we've entered tier 1 of our recovery or reopening program phases, and so we screen everyone coming in. We still have our tight 0 visitor restrictions. Now, certainly there are patients that you're going to have a caregiver with, right? And so, but we screen every person coming into the building, asking them a series of questions, asking them about health concerns that they may have experienced or had, or people in their residence or that they've been in close contact with. Everyone gets a mask coming into the building. And so, once again, going back to that community support, we wouldn't be able to do that without the support of the volunteers in the communities to help us accomplish these goals, right? We've begun holding a series of webinars for Greater Fort Wayne. Just finished a series of webinars for businesses on how to open up safely, how to reopen safely. We've developed information on our website, parkview.com/businessconnect, that allows businesses to go to our website and learn about things to help open up safely, help open up to keep your employees safe, keep your patrons safe, so that we can rebound from this. It's not going to look the same tomorrow as it did back in January. It's just not. And
What was that website?
it's parkview.com/businessconnect. And we update information on that regularly to help our businesses and our communities reopen with confidence and safety. You know, we all want to get back to a normal, right? But it's going to be a new normal. We don't know what that's going to look like. And I think, you know, one of the benefits I believe that came out of this was really having to look at how we've always delivered in recent times, healthcare, and how can we deliver it differently and still accomplish what we need to accomplish, but limit and decrease exposure of our patients and our communities to things they don't need to be exposed to. So I mentioned telehealth a little bit earlier, and you know, I'm proud to say this is probably one of our greatest benefits that have come out of this crisis is our development of a much more robust telehealth model, and it gives patients the ability to have conversations, have virtual visits over the computer through their iPad with their healthcare provider, so that they aren't missing out on continued health care. They're able to get it from the safety of their home or their residence, and it's, I think, just been a great thing that we've been able to accomplish. I think we've realized, and the governor spoke to this as well, that there is a true ability to work remotely, right? I think we as a society have gotten into this model of, you know, you've got to go into the office and you've got to be in the office 9 to 5 or 9 to 8 or whatever it might be to get the job done. And I think we found that we've been able to find ways to have some of our workforce work remotely and still be able to get done what needs to get done, and it keeps our workforce healthier, right? And decreases that exposure. So, you know, it's been really good, and so I look forward to what our incident command focuses on through these next tiers and phases. So, you know, the governor talks about the 5 stages of reopening Indiana. At Parkview, we focused on the 3 tiers of reopening and what that looks like. How do we bring patients in? What's the right number of patients to see in the office in a given day? How does telehealth continue to play a part in that? Where you may have seen 40 visits in the office in a given day, you might see 30 going forward with 25% telehealth continued on, trying to help that social distance and maintain that protection. I'd be remiss without thanking a number of people. The community. I've said it before, but we couldn't have done this without the community. I'm so thankful and so proud of my team at Parkview Warsaw and my team at the system level and Whitley for coming together and really facing this challenge head on, keeping the patients in our communities and our coworkers front of mind. And I have to do a shout out to our nursing staff. Today's National Nurses Day, and we could not have survived this crisis without our dedicated nursing staff. And they come in, they've been faced with immense challenges. We, as Dr. Remington has said, we've seen an uptick in cases, and so we've got additional cases coming into our site here at Parkview, Warsaw. We've got an increase in numbers at Whitley, and the challenges of dealing with the increased isolation rooms and all that goes into donning and doffing the personal equipment and taking care of that patient while keeping themselves safe. And they do it, and they do it with their whole heart, and they do it every day, and I'm so thankful for them.
Thank you, and I would be remiss not to thank Parkview. I know we got involved in the GFW series for businesses to reopen, and it was very helpful. And again, I would parkview.com/business select connect would be a great resource for our local businesses as we're all looking at appropriately coming back. To that end, the governor did ask that businesses create a plan for reopening and safety of their employees, and this would be a great resource for businesses as they get through that. I did have another thing I wanted to clarify. I was just reminded, I had talked about the resumption of our Friday night concert series. That is separate from our classic rock concert, from our country concert, and from our blues and barbecue. Those have all been canceled for the year. The Friday night series that I was referring to is typically done over in the plaza in the park behind Glover Pavilion. It's a smaller venue for that we feel like we can socially distance. That typically starts in June. We're pushing that back into probably early to mid-July. And again, that's far enough away that that's our plan, but we are not totally committed to that until we see where we're at as we get through these first couple stages, stage 2 and 3. But again, I don't want folks to think that the classic rock concert, the country concert, and the blues and barbecue concerts are on. They are not. Those have been canceled for the year. This is our smaller Friday night series in the plaza. So sorry if that caused any concerns. I also want to mention Farmers Market opened up last Saturday. There was a lot of activity. I did get down there myself. I know I was at times standing, socializing, and feel like that, this is something that I had said last week. We need to get down, get your items, and get out. It's hard to take something that we've wanted to create, a social gathering, and try and make it just business. But we would ask that with farmers market being open again this Saturday, that you come down and observe that social distancing, just like going into the grocery store. If you need to, wear a mask and get out when you're done. Hopefully later this summer we'll be able to spend a little more time socializing, but for right now, let's try and keep that going that way. Churches, I've actually had a couple calls from churches. I know they're all working hard. I won't comment specifically on any churches other than they seem to be taking these challenges as serious as anybody else. They're trying to work through how they're going to provide religious services to their communities, their faith communities, in light of the governor allowing basically churches within their house of worship to resume with no numbers, no restrictions on the numbers. But I don't believe there are many churches that are not concerned about that and are trying to reduce the numbers coming in, continuing with their weekly televised services and stream services. That still seems to be, from what I've heard, the plan. But I know churches that are opening up are taking very serious consideration on how they're going to handle their church services, and certainly appreciative of that. With that, I think it's probably fair to start with our question and answer for our press who are assembled here.
Sure, we'll start. Dr. Irvington, we got a message on our Facebook page from a worker who works in the restaurants. She says that she's still worried about going back in when the restaurants open up. She's wondering if it should be time for them to feel safe to come back to work. If not, what sort of precautions should they take while they open back up? Or that could really go for any business or any employee that's kind of on edge of going back into work.
I think that's a very valid question, and certainly is the big question as we open up. Everybody wonders how safe this is. The risk is not zero. It's very difficult to perfectly quantitate that risk. The risk, I think, plays into the underlying health and age of the individual contemplating going back to work. How distant can you be from the general public as you go back to work? Working as a server in a restaurant, I could see that would be challenging. I would say to that employee, work closely with your employer to understand what the expectations are on both sides in regards to mitigating that uncertain risk that we all will face. Just knowing the data for Kosciuszko County specifically, again, we have been very fortunate to have the absence of huge pressure from known very sick COVID cases in our county. We undoubtedly have had a lot more cases than what we have ever been able to test and confirm. But I would venture to say many of those were several weeks ago. I'm sure I know we're seeing more new cases, but I don't think the worst is ahead of us yet. But again, that's why we're doing this incremental opening up, so that we can take a few steps forward, pause, take a look at the metrics from a public health perspective. So it's a long-winded answer to that common question, which illustrates how difficult giving the best answer to that employee is. But head back to work if you must, for sure. Take the precautions you can. Don't forget good hand hygiene. I mean, we forget about that. Just hand washing, using an alcohol-based hand cleanser. That alone is probably one of the key mitigating things you can do. Great question.
I have a few questions, but I'll start with Jeff. And I don't know if you know the answer to this. Earlier this year, Parkview announced Parkview Warsaw was becoming Parkview Hospital. Could you tell me where it is in the timeline, if this pandemic has affected that, and how will Parkview
Thank you for that question. No, so yes, we did announce the expansion to Parkview Kosciuszko Hospital earlier this year. A number of our projects got put on hold temporarily due to the COVID crisis. So Parkview Warsaw's expansion was one of those. But once we get through this process a little bit farther, then we plan to proceed with the expansion. So it's been on hold temporarily as we address the crisis at hand right now.
And so no, like, idea of when it begin, it's just wait and see kind of thing?
No, we're hoping that we'll see some movement on it later this summer, likely. We may see some movement on the expansion or the extension of Mariners Drive in the interim. But right now we have to, keeping safety front of mind and first, we'd be remiss to start a non-essential construction project at this time while we're dealing with the crisis.
And then, Nick mentioned employee critical back. I don't know, Mayor, if you could speak, or Brad, about unemployment. A woman before this call meeting talked about how she can't get any answer on unemployment from the state, and she's living off her savings, which are about to go. Can you speak in general about unemployment? And I know it's not really the city or the county's responsibility, but.
I watch the governor's press conference every day, and I know that discussion has come up. Fred Payne is the director of that. I don't know if it's not workforce development. I think maybe he is, but at any rate, the discussion has been that typically in the past they've had maybe 30,000 unemployment claims to handle as a record number. And with this recent unfortunate change of events, there are probably 100,000 more unemployment claims than that. They're up over 130,000 claims, and I know they're overwhelmed. That question has come up at the 2:30 press briefings. I know they're trying to hire additional folks and improve their capacity, but I don't think there's any doubt that they've been swamped and inundated. I have heard, though, the comments that these delays don't mean that they will lose benefits from when they were actually eligible. So if they applied back in let's say, late March or early April, even though maybe they still haven't received their benefits, my understanding from those press conferences is that those benefits will be retroactive back to when they were eligible. So I think you're right. I share that frustration. It's a cash flow crunch, and it's a state system being overrun with just a multiple of more claims than they've ever had to deal with. Brad, any?
I mean, it was almost an overnight thing where they just went from the level they were at, which was very low, to where they're at now. And I think I can say they're doing their best, but
Sure, happened fast, like you said.
yeah. So
Okay.
And then, I have two more questions. One, about the parks, I wanted to clarify something. You said that basketball courts would be closed, but playgrounds are opening where kids are all over them crawling. I guess why are basketball courts being closed, but parks open? I'm trying to, I guess, in my head, trying to figure out.
Yeah, we're going to take a look at that. Again, as I mentioned, these restrictions, nothing's been finalized. We were just looking more at the dates and basing them off of, I believe the governor allowed playgrounds to be opened at a certain time. And I believe that was, let's see if I can pull that back up. Well, at any rate, I think it was stage 3. And we looked at potentially waiting till the next stage to do basketball courts because of the congregating that occurs and the, I mean, that's close physical contact on a basketball court. And it doesn't mean that we couldn't maybe open those up to shoot around, but that's a difficult issue. I'm not slamming the door on opening those when the playground's open. We're just trying to think through the best way to do that, again, to not promote what's going on as far as the spread. I've already got a complaint about not delivering picnic tables and things, and again, we're just not trying to promote those social activities too prematurely. So, that's our rationale. I know it's not easy. I wish the timing were better. What the comments we've made today about that, again, could be changed if we see as good of statistical improvement as we want. But I want to try and set the expectation with these things. And, the final decisions will be coming out on those. But it's important that we look at, we're looking at First Fridays, we're looking at fireworks, we're looking at, the Wagon Wheel Theater, we're looking at all kinds of social gatherings, and it's a daunting challenge to try and look ahead. My advice to a lot of folks has been wait till the last possible minute if you can with regards to these activities. Obviously, if you get into contractual problems where it's going to cost you if you sign a contract and then cancel, that's part of your decision making. But if there are events that, you can hold off making a final decision on, and I would suggest everything we talked about today is in that realm, that, let's just, again, focus on our stage right now, stage 2, and see what happens. And maybe going into stage 3, some of this will change. But again, we're just trying to really set the expectation for stage 2, which we're in right now, asking for continued diligence on the part of all these mitigation measures. And as far as the things that are opening up, trying to make the best decisions we can, but the information continues to change. That's been kind of the theme of this whole thing. Things happen quickly, things change quickly. Some of the complaints I'm getting about not doing things quick enough, next week could be totally different if we had an outbreak. So we're just trying to straddle the line a little bit and walk the tightrope. I know we're probably not making a lot of people happy, and hopefully the majority, though, are feeling that we're trying to be somewhat prudent and moving ahead. And I know others don't think we're moving ahead quick enough, so it's not an easy job.
You could implement a rule that says if you're within 6 feet of somebody else on the basketball court, it's a foul. That'd be a new way of playing basketball.
We thought about that. Or just a bunch of games of horse,
There you go.
I'd love that. The skate park's another one. The BMX track, how are we going to handle that? We know we want to make these recreational activities available, and we want to kind of inch them in as we can. Maybe we open the baskets for horse games only. I don't see that as being real practical, though, because I know once the court's there, once the hoop's there, they're going to want to play, and I get that. So I wish I had a better answer, but I don't know that anybody does. It's a good question, though.
And then my last question is, Jeff mentioned today is National Nurses Day, it's National Nurses Week. My question is, how important are nurses, and do we have enough nurses?
Nurses are awesome.
They're awesome. And they are
I'm married
so-
to one, I have to say that. And I have a daughter and daughter-in-law. I have lots of healthcare people in our family. And I couldn't get through my day in the office without my personal nurses, so kudos to them. Our health department nurses have been very critical through this, very critical. Thankful for them.
Yeah, I mimic that statement. I think they are just vital. We couldn't get through a day without them. We rely on our infection prevention nurse, our bedside nurses immensely, and so vitally important. And to answer the question, are there enough of them? No. I've got 2 daughters that are nurses and a son who's going to nursing school, and it's a great profession, but there's just not enough of them. We need more.
Yeah, I've got a daughter on the front lines at a hospital in Phoenix, and she's on a COVID team, and what do you say? You know, that, it's a commitment. They're right there.
Yeah.
None of them are backing off.
No, and so proud of them. It's,
Yeah.
you just, you know, they truly are giving their all to our patients and our communities, and you can't be anything but proud.
Yeah.
I know even way prior to this, one of the local nursing homes said that was one of their biggest problems, was just finding nurses, I mean, specifically, so.
The nurses and all the other healthcare workers, they're all in there together, and that's certainly probably need more than a day to thank them, but it's nice to have a day set aside. So, all right, well, if there's no other questions, we'll be back next Wednesday, same time, and appreciate our guest today, Jeff from Parkview, and Commissioner Jackson, and Dr. Remington certainly provide us with a continued update on a ongoing, rapidly changing situation, and we'll see you next Wednesday. Thank you very much. Thank you, Mayor.
Thank you, Mayor.
Thank you.